everyone, and welcome to part 3. This is Connecting the Dots with Dr. Ashaye, and we're doing a series on perimenopause and menopause. And today I'm excited because we get into the juicy part, which is treatment. So I'm Dr. Adelola Ashaye. I'm a board-certified family medicine and lifestyle medicine physician and owner of InTouch Primary Care in Sugar Land, Texas. And welcome to Connecting the Dots with Dr. Ashaye. So if you or your loved ones have been putting off care due to healthcare frustrations, maybe you feel like you're not being heard, you're being rushed through visits, you're not being, no one is calling you back, and you're seeking a more personalized approach to your health. You know, you want to spend more than 15 minutes with your doctor a year. You really want to understand what it means to be proactive about your care. I invite you to learn about our membership program. At InTouch, we're dedicated to making high-quality healthcare both accessible and stress-free. So let's dive in. But don't forget to subscribe, share this with a friend, and schedule a visit if you would like to start your healthcare transformation. All right, so we're talking about perimenopause and menopause. And if you're feeling like you just want to survive this transition, if you're feeling disappointed, you are looking forward to no longer having periods, and now it feels like you're worse off than when you were having periods. And I just want to talk about the help, that there is help, and you don't have to be afraid of the options. So we're going to get into what really works, what's safe, and it's a personal decision, but it's one that you deserve to make from a place of confidence, not confusion. And that's what we're going to do today. Okay, so just to recap, in part 1, we talked about perimenopause and menopause and how hormones like estrogen and progesterone and testosterone affect more than just reproduction. In part 2, we looked at the wide range of symptoms women experience and why it sometimes is confusing and frustrating to get a diagnosis because of the many, many symptoms and how it presents in various ways in various women. And today we're going to walk through what you can do about it. And we're going to start with the simple stuff and, go from there. Okay. So let's start out with something that is whispered about, but maybe not even mentioned at all. And that's vaginal dryness. So vaginal dryness, painful sex, recurrent UTIs, and even urinary incontinence or leakage of urine are symptoms that some women have and never mention. Unfortunately, these symptoms can be very common after menopause, and it can impact people's health, their confidence, their comfort, and their relationships. The good news, though, is there is strong evidence that vaginal estrogen is very effective and very low risk for management of these symptoms. And the reason is because the amount of estrogen absorbed into the body when it's applied vaginally, usually through creams or tablets, sometimes rings, is minimal. And so we're talking about micro doses that stay locally in the vagina. So women, your relationships do not have to suffer. Intimacy doesn't have to be painful. You do not have to avoid sex because of dryness or irritation. This is something that can be gently and easily reversed. So this is important to know that there is help for these symptoms. So if you do have symptoms like this, don't suffer in silence. Book an appointment with your doctor so that you could start treatment for these symptoms. Okay, so you might say, so what about everything else? What about the hot flashes, the night sweats, the brain fog, the sleep issues, the anxiety, the fatigue, just the feeling that you're no longer feeling like yourself? Well, that's where hormonal therapy comes in. But let me be clear, with hormonal therapy, this is a personal decision. This is something that is certainly not one size fits all. And it's so important that as women, we get educated about what's going to be happening, to our bodies. And so one has to make the decision about hormones on their own not completely on their own, but need to decide on your own if it's a good fit for you, and then talk with your doctor about it, about risk benefits. But it's a personal decision at the end of the day. But one of the things that affects people's decision is understanding the facts. So one of the concerns I've heard that people are concerned that hormone therapy can be dangerous. You may have heard maybe it causes breast cancer, strokes, or heart attack. And that fear came from a study called the Women's Health Initiative. It was published in 2002. And I'm just going to do a very brief backstory. The thing about the WHI study, the Women's Health Initiative study, is it looked at women who took a combination of estrogen and synthetic progesterone, but there were many issues with the population that it looked at. The average age of the participants in that study were 63, which is well past the typical onset of menopause. Over 70% of them were overweight. About 50% of them were current or former smokers. So these were not newly menopausal healthy women. And the data that they extrapolated from that study had a lot of problems as well. And they have come back after that to correct some of those things that were initially concluded. So the type of hormone used was not bioidentical estrogen, it was synthetic version, which was paired with a synthetic progesterone. So what we found is a lot of the things that were concluded from that study are not applicable to the average woman starting hormone therapy, which is about 50, which is right after menopause. Also, many newer studies have shown that starting hormone therapy within the first 10 years after menopause does not only doesn't increase risk, but may actually decrease risk of heart disease, osteoporosis, type 2 diabetes, colon cancer. I mean, this is a big deal. These are conditions that affect women and that can lead to death in some cases. And so having a reduced risk of these conditions is really a big deal. So let's talk about hormone therapy and what it actually is. So hormone replacement therapy, HRT, includes estrogen, which is delivered as a pill, patch, gel, ring, or cream, and progesterone, which is often an oral capsule. And the goal of the progesterone is really to protect the uterus if you have a uterus. So if you do not have a uterus, you don't necessarily have to be on progesterone. And in some cases, testosterone for people with low libido energy and needing to build up muscle strength. The goal is not just to mask symptoms, it's actually to replace what the body used to make. And often by doing that, it restores balance. And for many women, it's actually life-changing. But hormone replacement therapy is an individualized decision. And so it's really important to work with someone who will take the time to look at your history, your symptoms, and your goals and help you decide, how to go forward. It's important, though, to know that hormone replacement therapy isn't just about feeling better. It can actually be a preventative strategy. We know that estrogen helps protect the bones, the heart, and the brain. And when it's started at the right time, it can help slow aging. And we're going to talk more about this in the next episode about how hormone replacement therapy can help optimize health. It can be part of a long-term plan, not just to, survive, but also to thrive. So that's what we're going to be talking about next week. We're going to talk about how getting into the long game, how menopause treatment can support heart health, bone health, brain function, and overall quality of life for decades to come. So if this video helped you, and obviously we can't go through everything here, but if you got some clarity, some hope, some more information, please go ahead and subscribe, share it with someone that might need it, someone who may be struggling and wondering if there's help, and let them know they don't have to go through this alone. I hope that helps.